Think we're live. I'm just looking for the preview on my second screen. So for those of you who are watching us, thank you for tuning in. I'm here with Dr. Claudia Alvarez. She is a hospitalist and family medicine doctor, and also my client. Love having you and you dedicating your time. I know you're super busy in the clinics and the hospital right now, so thank you. You also dedicated your time to my ADHD adult support group. So I can't thank you enough. I know your time is very valuable.
Hi, Brooke and everyone. I'm very happy to be with all of you. My name is Claudia Alvarez. I'm a family medicine physician. I just finished my 7-day shift at the hospital. So today is my day off before I go to work tomorrow again at the clinic at the Federally Qualified Health Center. I'm very happy to be here, and the experience at the ADHD support group was fantastic. So thank you for granting me the opportunity.
Awesome. So can you share with the community a couple of things that you're hearing, noticing? I know that there's a lot of myths and facts out there already, but you have the firsthand facts and information. So if you could just share some updates with everyone here, letting them know some important information that they can use.
Of course, Brooke, thank you so much for giving me this opportunity again.
Brooke and everyone experienced at the ADHD support group was with that.
So what I would like to say first is that I hope everybody is following the recommendations that have been given by the CDC and by the majority of the cities and even the whole country to stay home and only leave when you have to make essential visits to the supermarket to get groceries or to pick up medications at the pharmacy or to buy essential goods. And if you are going outside, you have to keep a 6 feet distance or 2 meters of distance from the other. This will help prevent further multiplying the virus, the coronavirus 19. Mm-hmm. I wanted to let you know that I know there has been some rumor or myth, or it's actually been said possibly in TV that there is an antiviral medication and also an anti-malarial medication, Plaquenil or hydroxychloroquine, and the other one's Remicade. Those two are not evidence-based to treat the coronavirus 19. Those two are just in trial, and they have been anecdotes that it has improved in some cases. So right now, it's an experimental drug for the coronavirus 19. It is definitely not a drug that has proven to remove or cure or take away or mitigate the effects of coronavirus 19. So right now, we do not have a specific cure and a specific medication that will take care of that. But so the best cure that I can talk about is prevention. And so prevention, and hand hygiene. Washing your hands for 20 seconds with soap on top and on the bottom. That is much better than hand sanitizer sometimes. If not available, then you can use a hand sanitizer. But it's much better than using gloves or needlessly gloves. The most important thing is for you to continue with hand hygiene before and after you touch your face, if you touch your face, because we're trying to tell people to avoid touching their face, their nose, their mouth as much as possible. But if you find yourself that you do that, wash your hands as soon as you just did. Also, before and after touching any surface, before and after eating, of course, going to the restroom and all that, but even in every surface, because the virus can stay in surfaces from 3 hours to up to 3 days. And there are some surfaces that have longer length of stay versus other ones like plastic or wood. So that's why we try to avoid being in places where you don't have to be, where you're going to touch the handrail. So if you're going to go to a park on your own where there's not a lot of people, or very, very far away, isolated, avoid touching the handrails, avoid touching any surfaces, any walls, anything that could be touched by other people at the same time.
Thank you.
Mm-hmm. Also, you don't have to wear a mask everywhere you go unless you are sick.
Right.
If you are sick, you do have to wear a mask because you potentially do not want to spread your secretions or any air that you're bringing out. So secretions, I mean like, mucus, cough, sneezing. But if you are sick, you're also likely not going to need a mask when you go outside, because you're not going to go outside. Because if you're sick, you're going to stay in. Yeah, there's a trick over there.
So a lot of people are saying, they're going to wear the mask anyway because they don't know if they're sick with the virus. So you were just saying that it's spread through secretions, right? Like mucus, sneezing, all of that. But let's say someone, I don't know, thinks they have allergies and they don't know if they have the coronavirus. Should they still be wearing a mask if and when they go out?
If they absolutely have to go out to pick up medications and they're not sure, yes, wear the mask. And yes, the right now it's known that it's a droplet transmission. So that's why, with sneezing, with coughing and touching surfaces, because sometimes when we sneeze or we cough or we touch ourselves, then we touch a surface, and then that's when someone else can also touch that surface. That's why it's hand hygiene and droplets.
Sure.
But yes, I would say if you're not sure and you essentially have to leave, then yes, please wear a mask and avoid touching anything, regardless. But the recommendation right now is if you are feeling a little bit ill, slightly, maybe just some, like I said, runny nose or cough, but you're not having any shortness of breath, you are not having any, you're not feeling that you cannot stay, that you need more support, that you need medication. If it's just like, like a little cold that you're having, stay home, call your clinic, call your primary care physician. If you don't have one, call the Department of Health of your city, your county, and even up into your state. Call the Department of Health and tell them what you're feeling. And then they'll ask you a couple of questions and see what's your exposure or, percentage or risk. And then they'll tell you whether you need to go get tested somewhere in a specific area, because now there's some specific areas where you can go get tested in your car various times, or whether you should stay home and see how you're doing and then seek help in like the hospital when you're starting to feel that you can't do this anymore, that it's not like a regular cold or you're feeling any shortness of breath.
I'm sure a lot of people around here are concerned about, like, when can they connect with their family members?
Of course. Right now, the recommendation is do not connect with your family members in person. Right now, especially people that are below 50 years of age are at risk of transmitting that virus and transmitting it to your family members. Mm-hmm. So while we do love our family members, we love them to be healthy and to be well. And taking the risk of going to your family members, there's a risk, and being with them in person, there's a risk of you transmitting the virus. Even if you don't have any symptoms, you can still carry the virus. And then that can be very severe for our older population, especially, or the ones that have medical conditions. So
I also heard infants too, right?
Excuse me?
Also for infants, is that correct?
I have not they can transmit the virus, but I have not I've not received any sort of information yet that it has affected infants in a detrimental way. I can certainly, I will continue seeking that investigation, but as far as I know so far, not children, not, it hasn't affected children in a detrimental way that it has to the older population. So right now we're asking everyone to do FaceTime, conferences, video conferences with your family. And if you absolutely have to see them or transmit them, stay in the car and then the other person in the car, because you really want to keep the 6 feet distance so that there's no chance that your family members can contract the virus.
Got it. Can you, if you absolutely have to go outside for the essentials, can you just advise people what to do when they get home?
Of course, absolutely. When they get home, wash your hands. The first thing that you have to do for 20 seconds, minimum 20 seconds with soap and water, very well. And you don't necessarily, unless you work in the healthcare profession, you don't have to remove all your clothes and change your shoes or anything like that, unless you are working in an environment like the hospital, the clinic, or a pharmacy or somewhere. If you are maybe at work in a grocery store, you essentially have to go to work because you're supplying food to people. Then I would recommend to shower as soon as you come home.
Yeah. So, I mean, let's say I'm sitting on a bench somewhere on a park, now my clothes are touching a metal surface. I don't know who sat on that before. I come home. Should I literally just take all of my clothes off as soon as I enter and shower my hair, everything?
I don't think you need to. I don't think there has been any data about like it staying in your hair unless there are secretions in your hair necessarily. That is a good question because if you're sitting in a park and bench, I also don't have the data for the clothes, how long it can stay in clothing surface. Mm-hmm. For how long it can stay in the clothing surface is different when you're a healthcare personnel because then you're around it all the time and then you can have unwanted or unknown secretions and air that stays in your clothes because you're around it.
Right.
But for a bench, I think if you don't necessarily have to do it, but if it makes you feel a little bit more comfortable, then yes. And like you said, sitting on a bench, then if you're touching the surface, wash your hands first. But it's not going to hurt you for you to change your clothes and take a shower.
Right. Take all those precautions. Right.
Yeah, it's a precaution. Absolutely.
Right. So you said that unless you're the sick one, you don't need to wear a mask. I know a lot of people are wearing gloves if they have to go out. What else have you been hearing or experiencing that maybe some other individuals may not know or may have misinformation?
Well, besides the Plaquenil and the medications and the gloves, which by the way, you also don't have to wear gloves. You just have to practice good hand hygiene. Another thing that I've encountered as a myth is that the virus does not come to Miami, does not come to Florida because it's a hot area. That is not true. We have a lot of cases in Florida, including Miami, which is where I live and practice. And it continues to come positive, a lot of cases to spread. So usually coronavirus, not this strain, but other strains and other viruses like the flu or like this coronavirus have the biggest peak in the winter, but it can go up until April. And sometimes we see them in the summer, even if usually that's not when that's their peak. And with this new coronavirus, it's still here, and we are hoping that it will trail down and come down during the summer. That's our hope. That's what we predict, but we won't know yet.
Okay, so it sounds like there's a lot of unknowns. But the main things is wash your hands every time you touch a surface, every time you touch your face, every time you obviously use the bathroom, proper hygiene, of course. A minimum of 20 seconds, practice 6 feet social distancing. If you have to go out, make it quick and essential, but try to stay home. Wonderful. Awesome.
Yeah, I also want to give another tip about people have been asking whether they can go onto the park or for a run or for a bike or for a hike. The answer is yes. If you're going by yourself and for a run, for example, you're there by yourself. So you can go for a run outside. It's not a problem. The thing, and then if you want to go to a park, it's okay as long as it's not a park that it's with a lot of people around you. You don't want to be around people, and people also don't want to be around, you don't want anywhere where you're going to be close to others. So again, practice the 6 feet distance and try to go somewhere where there is not a lot of people around. And again, I repeat, where you don't touch the handrails and you don't touch any rails and touch any surface that might have been touched by other people.
Sure.
But yes, you can go for a bike ride. You can go for a run. You can go to the park on your own. Yes.
Yeah. What types of things keep your house clean? So let's say you have to go to the outside world to get some groceries and you come back. How do you make sure you maintain a clean house? Any thoughts about that?
Yeah, I mean, honestly, the regular cleaning supplies are sufficient, including vinegar. Vinegar is a great cleaner, natural cleaner and disinfectant. So you don't have to get the hospital cleaning supplies to clean your house, because your house doesn't have the bacteria and the virus that the hospital carries. So, I know also that some people have been stealing supplies from the hospital. And first of all, that goes against, healthcare professionals and your community, and it defeats the purpose of having a hospital, having a safe place for people to go. And second of all, it's absolutely unnecessary, very unnecessary, because your house has the natural regular germs that can be taken away with any sort of cleaning supply that we have out there. And vinegar actually as the best.
White vinegar?
Yes, well, there is one white vinegar, and also there are some cleaning supplies that come with vinegar, but yes, white vinegar is one of the best ones that
the distilled white vinegar? Distilled white vinegar?
Yes, mixed with some water, I believe.
Okay.
And there's some cleaning supplies that are vinegar based.
Okay.
Also.
Good to know. Lysol, if you can get it, I'm sure.
Yeah. And just, the Windex or Clorox, all of those that people normally use there's nothing different about the cleaning supplies from this virus. It's just your regular, clean your house well with the regular cleaning supplies that you have. And if you don't have enough, you can use vinegar.
Got it. Thank you. That's awesome. So is there any truth, because I heard about gargling your mouth with vinegar or with salt. Did you hear anything about that?
Actually, that is a very, I have not heard of people doing that for coronavirus, but that is a very traditional cultural use in Latin America, gargles with salt. But that is a natural remedy for sore throat.
Oh, got it.
It's for sore throat. Gargles with water and salt. I have not heard about the vinegar gargles, but there has been apple cider vinegar that people take every day just to increase their immune system. That's just a natural remedy, or natural medicine that has been used by people in general, but this is not specific to the virus. It's just if you have a sore throat and you want some relief, you can do gargles with salt and water. That helps a lot. Personally, I've tried it.
What about gargling with mouthwash? Does that help prevent anything?
No, No, not at all. No, I mean, I believe that is more for dental prevention and precautions. That's why people use Listerine and all of those. That's fine, but it's more to prevent your cavity, and your flora and your good bacteria in your mouth, but it won't prevent you from getting any virus. Definitely not the coronavirus.
Okay, got it. Oh, very helpful. So essentially, I'm hearing from you, really don't believe anything else, just practice safe social distancing and hygiene.
Yes, there is one more thing I want to touch upon now that we're talking about medications. If you are feeling sick at all, no matter your age, do not take ibuprofen, do not take naproxen, do not take diclofenac, or meloxicam. Some of the other brand names are Voltaren, Motrin, Aleve, because there has been a correlation, which means we don't know if this is causing anything, but there has been a correlation that if you use these medications for coronavirus, you can have worse outcomes, or you can have, you can get sicker from that. This is from a few cases in Italy from younger patients that contracted coronavirus and got very, very, very sick. And the only thing that they found that was common between the young patients was that they were not feeling well, and they started taking ibuprofens, Motrins, those kinds of medications. Those are called non-steroidal inflammatory NSAIDs. So I do not recommend the public right now to take those while we're going through this pandemic.
So if someone has a high temperature, very high temperature, obviously they need to call their local hospital or doctor. But what do they do?
You can take Tylenol. Tylenol is a safe remedy for analgesic. So you can take 500 milligrams or 325 milligrams up to 1,000 milligrams at one time of Tylenol. Wonderful. You cannot just go 4,000 milligrams in 24 hours of Tylenol. But you can definitely do that. That's a good analgesic. The other thing, people sometimes use aspirin. Do not use that for fever relief. And also do not use that for pain or to try to feel better. If you take aspirin on a regular basis for your heart, that's absolutely fine. Continue taking that. But don't use aspirin to treat fever or to treat pain.
Got it. Wonderful. Thank you so much. I really appreciate your time. I know we're on live right now, and I was trying to check before to see if anyone had any questions. I don't see any at the moment, but if someone had a question, could they comment in the section of the video and perhaps you reply at another time?
Absolutely. I can't see the video of the comments right now from my end, but of course I can answer any questions afterwards. I just want to remind everyone that this is a situation that is being investigated in a daily basis. So we get new information every day. Thankfully, we've come with some guidelines from other hospitals in other cities, and some things that we knew before we'll know tomorrow, and some things that we thought were maybe will not be tomorrow. So it's a continuous update and on this situation. Okay.
Thank you, Dr. Alvarez. I really appreciate your time. I know it's valuable, and thank you for the wonderful information as always.
Of course. Thank you so much for having me, Brooke. And thank you, Coaching with Brooke. It has really improved my life and my lifestyle, my way of organizing my day, especially working at a very, very busy hospital. So I recommend Coaching with Brooke to anyone and everyone out there. Okay. Even physicians.
Totally unsolicited, everyone. Thank you. I appreciate that. Thank you. Have a great day, and I will talk to you soon.
Okay. Stay home, everyone. Stay home. Okay. For public health, for your grandparents, for your friends' grandparents, for your mom, dad, stay home. For yourself, stay home.
Thank you. Have a great day.
You too. Bye-bye.